Well, prostate cancer is the second leading cause of death in American men after lung cancer. And if you or someone you know has been diagnosed with this disease, you may have wondered which treatment option is best. Joining me now is Dr. Mark Edney. He's the president-elect of the American Association of Clinical Urologists. Welcome to the show. First question is, what treatment options for those out there dealing with this are available right now for prostate cancer?
So the treatment options for newly diagnosed prostate cancer range from surgery to remove the prostate, radiation, which is energy delivered from outside the body to the prostate, or even freezing procedures, which is called cryotherapy. Finally, there's an important option called active surveillance, which is increasingly being used, which is observing prostate cancer that may not be that aggressive and may never need to be treated. And active surveillance is important because using active surveillance reduces the rate of overtreatment of prostate cancer, which is a significant problem.
Yeah, I was reading that, and then you just said it there. As far as overtreatment, I've never heard of this. How is overtreatment of prostate cancer a problem?
So overtreatment is when most men who are diagnosed with prostate cancer get treated. We know, based on how prostate cancer behaves, there are some types that just don't grow that fast and ultimately probably never pose a risk to a man. And until now, until the advent of these genetic tests that we have available now, like ProLARS, we have not had a laboratory tool that helps us separate out those low-risk prostate cancers. And so going back, we always used to treat them, and that technically is referred to overtreatment. But with the use of genetic tests like ProLARS, we are able to identify men who have low-risk prostate cancer and who can safely be watched.
Oh, okay. All right, I get it now. All right, let's talk about this as far as the genetic test you just mentioned. How does that help the situation?
So the genetic test, I'll raise the analogy of you imagine three cars on a raceway and trying to decide which car is going to run fastest. It's like trying to decide which prostate cancer is going to be the most aggressive. You can visually inspect the cars and look at the body style and maybe what's painted on the side and try based on that to estimate which car is going to be fastest. What genetic tests like ProLARS do is allow us to get under the hood and actually look at the machinery of the car and make a much more specific prediction of which of those cars is going to run faster or which prostate cancer is going to grow a lot faster. So that's the power of these tests in helping men make this very important decision.
All right, so if somebody chooses or is going to have active surveillance as their option, what are the benefits of that?
The benefits of active surveillance are that you are able to put off indefinitely and perhaps forever the potential side effects of treatment. Being treated for prostate cancer comes with very well described and known potential side effects, which can have a significant impact on quality of life. These are side effects like urinary difficulties, leaking of urine, sexual dysfunction, those sorts of things. And so if a man is able to watch rather than immediately treat the prostate cancer, he's able to put off those potential side effects and enjoy his current quality of life.
I like the sound of that. Let's talk about the ProLARS test, the test, how it works, and what are the benefits?
So every cell in the body has genes, and genes are the instructions that tell cells how to behave. And prostate cancer cells have genes telling them how to behave. And what the ProLARS test does is it samples those genes in the prostate cancer cell and asks the question, how aggressive do these genes look? What are they telling the prostate cancer cell in terms of how to behave? And we get a report back saying the genes are telling us this is a less aggressive looking prostate cancer. Or we can also get the other side. We can say the genes are telling us that this looks more aggressive. And that's incredibly powerful information, incredibly reassuring information for men and their families as they make this very important decision initially is whether or not to treat their prostate cancer. Because again, as I said, those with more aggressive cancer should be treated. Treatment does potentially come with side effects. So it's a critically important decision. And this is a powerful new test that gives men the comfort of knowing that they're making the best decision they can make at that time.
Is the ProLARS test something you're using every day in your practice, or is this something people have to request, or how does it work?
I use it all the time. So I diagnose on average about one new prostate cancer a week in my practice. And I rely heavily on the ProLARS test to help give me and the patient and their family that critical piece of information about aggressiveness of their prostate cancer. Because again, a lot of the prostate cancer we're diagnosing is of the less aggressive variety. And until now, until we've had this important tool, this Polaris test, haven't had very sharp tools to be able to tell the patient yes or no, this is aggressive or not. The genetic information is incredibly important. So I use it all the time to help men with that initial diagnosis of prostate cancer make that important decision.
Is this something our viewers can talk to their urologist and request?
Absolutely, and that's my advice to viewers is if you're dealing with prostate cancer, you or a loved one, ask your urologist about the Polaris genetic test as useful information to help make this critically important decision. Additional information can be gleaned at the American Association of Clinical Urologists website, aacuweb.org, or the website for the test, which is ProLARS, PROLARIS.com, tells you about the test and the power of that test and the importance in making these decisions.
Appreciate you joining us. Great information, Dr. Edney.
Thanks for having me.
Good stuff. Thanks to ProLARS for bringing us that interview.